I would like to invite everyone to take a moment of silence to remember our county executive, Al Brooks Patterson, and his recent passing. He led Oakland County with grace and authority, and Oakland County is well known throughout the United States. It is one of the best counties to live, work, play, and raise a family in, as Brooks likes to say. So let's take a moment of silence for him. Thank you, everybody. Roll call, please.
Powell,
Here.
Oakenberger is absent with notice. Gershenson,
Here.
Nelson,
Here.
Taub,
Here.
Blue.
Here. We have a quorum. Let's all stand for the Pledge of Allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Are there any corrections to the minutes of the previous meeting on July 22nd? If not, we need to approve the minutes of the Healthy Communities and Environment Committee. I have a motion by Commissioner Nelson and a second by Commissioner Taub. All in favor signify by saying aye.
Aye.
Opposed? The motion is carried. Next is approval of the agenda. Are there any corrections to the agenda? Seeing none, we need a motion to approve the agenda. Approved by Commissioner Nelson, seconded by Commissioner Taub. All in favor signify by saying aye.
Aye.
Opposed? That motion is carried. We'll move on to public comment. Is there anyone from the public wishing to speak? Seeing none, we'll close public comment. We have one item under communications, the fiscal year 2019 through 2021 contingency report. So we'll receive and file that report. Motion by Commissioner Nelson, seconded by Commissioner Taub. All in favor signify by saying aye.
Aye.
Opposed? That motion is carried. We'll move on to our regular agenda. Our first item is Parks and Rec, approval of revised operating agreement with the Michigan Department of Natural Resources for an off-road vehicle park in Groveland and Howley Township. Do we have a motion? Motion by Commissioner Nelson, seconded by Commissioner Gershenson. Thank you. Welcome.
Good morning, Commissioners. Dan Stenzel, Executive Officer, Oakland County Parks. Melissa Prouse, our Planning and Resource Development Supervisor, and Jody Hall from Corporation Counsel. This item is being brought back to you. We had some questions from the state. They had a change in leadership within the Parks and Recreation portion of the Michigan Department of Natural Resources, and they asked to have some revisions made to this document, and I'll turn it over to Melissa to give you some of the high points.
Sure. Just as a sort of a high-level summary, as Dan said, by the time our commission, the Parks Commission, approved the operating agreement back in November, and then I think it was signed by Chairman Woodward in March. And in that time frame, when we sent it back to the DNR for their signature, they had a lot of changeover with the new administration and new staff that essentially just wanted a little more input into the planning and budgeting process for the park. So we have always had a great relationship with the DNR, and the language that was in there, I think, would have served us just fine. But they essentially just wanted a little more back and forth, a little more conversation about things like planning, master plans, the budget, the maintenance plan. So it kind of provides a little more structure for that, how we will do that back and forth and talk with them about getting those documents approved. So I don't know, Jody, if you have anything else that you think needs to be pointed out or clarified, but
No,
that's.
I believe we submitted the red line version.
Yep.
And you'll see most of the same revisions are made through each of the subsections in section 8, and the reasoning as well. Melissa gave you.
Yeah, it looks like a lot more edits than it is because we swapped out the language in every section.
Any questions? Thank you, everybody. Thank you. It's a marvelous addition to Oakland County. Yeah, oh, we do have a question.
I just want to make a comment. I had the pleasure to attend the opening here just a couple of weeks ago to the public.
The
for
media
press,
and
the
the-
media press.
Yeah.
VIP.
And what a really cool site. I'm really excited to have it be opened and bring the public in because I really think it's a good addition to here in
It's a
Oakland County.
good reuse of, what was typically unusable. Now, off-road vehicles will be able to utilize that facility for years and years. It was 50 years in the
I love it. I'm excited.
And just as if I could, as one last reminder, so the park will officially open next July, so you all will be obviously invited to that, and we'll have a big event out there. In the meantime, you have a flyer in front of you. This is the Detroit 4Fest that's being put on September 14th. It's not a county parks event; it's a private company that's putting on that event. But you can pay to ride your vehicle out there, or it's free and open to the public to just come and check it out and watch the vehicles ride around. So we encourage you to come out and check that out.
Thank you. Yes, Commissioner Powell.
I was trying to see the date. I see it. I couldn't find it.
Thank you, everybody. Roll call, please. Oh, we need-
Powell,
Yes.
Gershenson,
Yep.
Nelson,
Yes.
Todd,
Yes.
Loops,
Yes, motion carries. Thank you.
Thank
Thank you very much.
The next item is Health and Human Services Health Division, Amendment 7 of the interlocal agreement between the County of Oakland and the Oakland Community Health Network for Suicide Prevention Services. Anybody want to make a motion? Motion by Commissioner Taub, seconded by Commissioner Nelson.
Good morning, Leanne Stafford, Health Officer for the Health Division.
Kathy Forsley, Director of Oakland County Health and Human Services.
So this request in front of you is an amendment for carryover funds from fiscal year 18. Actually, the official carryover amount is about $23,500. And what we're looking to do with this money is we're going to offer additional Safe Talk and Assist trainings in the community. We have offered 2 this year, and so we're hoping to expand that as part of our work plan for fiscal year 19. We also are looking to increase supplies and materials, so for future trainings, we will have additional materials so we can offer those trainings.
Thank you. Commissioner Taub?
I had a quick question. You are working, I think, with youth assistance and with mental health on another suicide program. How is that going for you?
That's good. I'm not sure the one you're referring to. We bring them into all of these trainings as well as we're preparing for those. And so I'm not sure of the event. Are you talking about an event that's coming up? Okay.
Yes. There was a training at Ocean. Okay. I think it was in the spring, if I'm not mistaken.
Mhm.
And it was very well received by my board in Birmingham. They thought it was terrific, and the speaker came from the Upper Peninsula. And that's what I'm talking about. They
Okay.
want to bring him down for a quadrant, or 4 quadrants, to speak to parents, to speak to students, and also to speak to professionals, and that's what we are working on now. I think Mary knows more about it than I do, but I hope you're familiar, I'm sure, with it. And I hope we can work together to get this all done.
I'm assuming it's part of the Suicide Prevention Task
Yes,
Force?
yes,
And
that's
so,
exactly
yeah,
right.
they work very closely together, and again, youth assistance, Oakland County Community Network, they're always involved as well, so I usually get an update every couple weeks, so I'm assuming that they'll bring that idea up to us, so yes.
Okay, thank you. Thank you, Madam Chair.
Thank you. Anyone else? Roll call, please.
Gershenson,
Yes.
Nelson,
Yes.
Todd,
Yes.
Powell, Loops,
Yes. Motion carries. Thank you, everybody. The next item from our Health and Human Services Health Division is Nurse Education Practice Quality and Retention, Registered Nurses in Primary Care Grant. Would you like to make a motion?
I would.
Thank you. Motion by Commissioner Tobbs, seconded by Commissioner Powell. Thank you.
Okay, yes, so this grant, it actually provides us funding to allow preceptors in the health division, so that is nurses that are already trained to do precepting, with nurses or BSN students that are in their fourth year program. And so they come to the health division with a nurse that, again, has been trained for a number of years at health division and community events. And they actually are trained and assisted and educated by these nurses. And so it really helps with retention for these BSNs. So as soon as they get out of school, they're familiar with what the health division does. And so that interest is piqued and they come back and we can hire them. So, nursing is one of those things where a lot of people start maybe at hospitals and maybe don't understand what nursing does at the health division. And so it really gives them an insight in what we do. And so Kathy just told me, which I didn't know, that this used to be something we kind of offered our time for, hoping that nurses would come back or the students would come back, but now we're actually getting funded for it. So it's actually a step in the right direction, so that's good.
Thank you.
You're welcome.
Questions? Roll call, please.
Nelson,
Yes.
Todd,
Yes.
Powell,
Yes.
Gershenson,
Yes.
Loops,
Yes.
motion carries.
The motion carries. Thank you, everybody. The next item, again from our Health and Human Services Health Division, is the Michigan Department of Health and Human Services 2019 Childhood-Led Exposure Elimination Innovation Grant. Motion by Commissioner Tobbs, seconded by Commissioner Gershenson.
So this is a continuation grant. We actually received this grant last year. And so what we're looking to do, the total anticipated budget is about $75,000. It is $75,000. It runs from June 1st, 2019 through May 30th of 2020. And what we're looking to do is continue to create a comprehensive lead program, and that's a lead testing program. So in this past year, we really focused on integrating lead testing into both of our WIC clinics, so NOHC and SOHC, and really trying to encourage everyone to get lead tested if they had not, and when they were in for our appointment. So that has gone very well. And what we'd like to do with this money is really expand that. So we're looking to partner with ULSA and do WIC testing in their WIC locations, not just in ours. We're also looking to hire a phlebotomist that can go out into homes and actually take confirmatory tests out in the homes, because what we see is what's happening is they come in, we see there's a level of lead that we don't like and it's above the limits, and then we try to get them to refer it out and they actually don't go to their primary care physician or their somebody that we've referred them to. So basically this allows, if the parents will allow us to go out into the homes and actually get that confirmatory test. Because once that confirmatory test come back, we can go out and do case management with our nurses like we do with every elevated lead, or do an EH inspection if that's what we need to do, so.
When you go into the home, does the nurse go alone or with somebody? With a partner?
Most of the time the nurses go alone. They're very skilled in this. Most of these are community nurses that have been trained in home visiting programming. So most of the time a nurse goes alone. But, many times a nurse and environmentalist may go together because, again, an EH person is looking at more of that environmental factor, and, the nurse is really focusing on the children and the parents and kind of assisting with that health piece.
Thank you. Any other questions? Yes, Commissioner Todd.
Are you looking at the homes for lead poisoning, lead paint as well? Are we still doing that? Because I just read something that said that, we've got problems with lead and water. We all know that because of old pipes and so on and so forth. But we still have a major problem with lead paint.
That's the number one cause for lead poisoning, not water.
I understand.
Yep.
Are the communities in Oakland County inspecting any homes at all for lead paint, or is that left up to the health department?
It's based on we receive all of the lead test results from anyone that's tested in Oakland County, and we follow up on those. And we do send our environmentalists out when there is a case of lead poisoning above a certain level.
Just one thing to add to that is one thing we did do as part of this last fiscal year is we put a toolkit together for the city, villages, and townships, the ordinance officers, and the township, so that when people come in and apply for permits for building, they're handed one of these toolkits that really explain the importance of lead testing in homes, you know, older homes, what to look for, you know, how, not necessarily how to scrape paint, but resources to go if you needed to scrape paint and things you needed to do. So that's been very well received by the CVTs.
Yes, in the past, many years ago, some of our worst cases were the result of people that were renovating their homes, and there was a tremendous amount of lead dust in their homes from sanding woodwork down to the wood, and both interior and exterior in the soil as well.
That was my concern. It's not just certain areas
Oh,
of the
no.
county, it's throughout the county, because you have some magnificent old homes wherever you are.
Right.
And I have some concerns. Do we notify then people who do the carpentry work? Are they well aware of?
Commissioner Tom, I can answer that from personal experience. When I've had new windows or doors or remodeling in my home, the contractor always tests for lead. That's added to to my contract of the work I'm paying, but they have always tested for lead.
Most of them have been through lead training.
Okay, that's good to know.
Yes.
Thank you, Madam Chair.
Yeah. Any other questions? Roll call, please.
Todd,
Yes.
Powell. Yes. Gershenson,
Yes.
Nelson,
Yes.
Loops,
Yes.
motion carries.
The motion carries.
Thank you.
Thank you.
Our next item is a presentation by the Michigan Department of Health and Human Services. So welcome.
Limited hand. Thank you, good morning. I'm Vicki Cooley. I'm the director on the assistant side of the department for the Michigan Department of Health and Human Services.
Okay, so she put the person who is not technologically inclined to do this. I will ruin it, I can tell you that. My kids keep me far, far away from technology. Good morning, I am Attorney Cherie Ross, and I'm one of the board members on the Oakland County, Michigan Department of Health and Human Services Board, as appointed by the county commissioners. You all. Okay.
I can handle that, right-handed. I apologize, I'm left-handed, so I'm really limited right now.
Okay, all right.
A little accident. I'm not as fast as I used to be. Okay, I didn't get this finger out of the way and cracked a couple bones down there, so.
She's not giving you the real dirty details. But
I
in
thought I
any-
was young enough to ride a jet ski, and when they tip over, you have to get your hands off the handlebars. So,
Good lesson for all of us.
yes. Yes.
Yes.
Yep.
All righty, so we are a part of a board of 3 members, which I'll talk about a little bit later. But not sure how much you know about the Michigan County Social Services Association, which we call MCSSA, and the PowerPoint is there. This kind of gives you the legislative process that took place that brought us into creation. And it gives you our responsibilities to some degree as to how we interact with MCSSA as the Oakland County board members. So we represent the county boards of MDHHS, who advocates for services of their respective constituents. And I'll just pause there to say that it's been a real interesting opportunity, if you will, to get to know and understand what the constituents of Oakland County's needs are as a board member, and to be very active and proactive in many ways that we can to ensure that at least the Oakland County constituents, your constituents, needs to get addressed. They are able to attend our meetings and have public comment. They're also able to write us as county board members if they have any issues and/or concerns. And we've been very fortunate to be able to have a good working relationship with both the county directors, Vicki Cooley on the cash side and Tom Shire on the child welfare side, in order to get any concerns that your constituents have as board members. We make sure that they get answers. So we are strongly encouraged to participate with MCSSA on the statewide level. And that's been really important because Oakland County is one of the largest counties in Michigan. And that allows us the ability to, at the state level, which is now, I'm giving you some little points that are not on your PowerPoint, that gives us the opportunity on the state level to advocate with the state department directors as well as the legislators on information and things that we feel impact our constituents in our local area. So Public Act 280 is the law that established a 3-member board. There's 2 of us that are appointed by you, the Oakland County Commissioners, and 1 that is appointed by the governor's office, the state. We're legally required to regularly advise the state director about the needs of the citizens being served through department programs and resources. And we are an advisory board, so also in that capacity, contractors within the community who wants to do business with Oakland County Michigan Department of Health and Human Services, for instance, like Innocenter for Children, some of your child welfare agencies, we get the opportunity to review their contract proposals and look at the dollars that they're requesting in those proposals, and to also make sure that they're actually providing the services that they're telling us that they're going to provide in the contracts that they submit. And we're always mindful as to whether or not they have if they've had a past history of performing the services and actually delivering on those services. And so we're always wanting also to make sure that our constituents are getting the best services possible. And the way that we're able to determine that is by our interactions on the MCSSA board. It gives us the ability to interact with all the other county board members who've been appointed around the state and look at what the best practices are in their particular counties, what worked and what didn't, and also to be able to then piggyback and make some changes in our community if need be. So having said that, you do not have a lazy board. We are very prominent and present at the state level. We attend the committee meetings, the conferences, and we've gotten to the point, because of the expertise that I'll talk about later, of the skill sets of the other 2 board members that serve with me. We have been making a huge impact with respect to being able to participate in the actual trainings. Dr. Gane Dudley, who's a licensed psychologist, is very well versed and knowledgeable of the opioid crisis and the Narcan trainings. And so we've been able to utilize those skill sets in Oakland County to be able to know how many of our constituents in our area suffer from opioid drug crisis and the Narcan training, what we need to do to ensure that the constituents of Oakland County needs are being addressed, and in those areas, how we can bring some kind of knowledge to the issue so that we can have a better impact. So we provide our professional experience to the board and likewise to the association. I talked about Dr. Gane Dudley. I'm not going to go through all of her credentials because there are a million, as well as Margaret Warner. And the fascinating thing about Margaret Warner is that she has been a director for the Department of Health and Human Services for many years, a regional director. She's directed in Oakland County. So she brings a wealth of knowledge to the board in that respect as well, in terms of the budgets and those kinds of things that we need to do. She has been serving as the legislative chair over the last couple of years or so for the association. And one of the interesting things, and this is not to discredit anyone, but one of the things that we've discovered with this term limitations, we get a new legislative body on a regular basis, who are not necessarily knowledgeable sometimes in the child welfare arena with respect to foster care, adoption kind of cases. And it seems like that right when they have, their term is getting ready to end, they've just reached the learning curve, and they now get it, and now they're gone if they're not reelected, or if they, and well, the terms are limited. So we've been really the continuity, the ability to bring the resources together and to maintain the continuity, so that we have an excellent relationship with our local legislators. Through MCSSA, we have a legislative conference where we get to sit down at the table with our local legislators and have conversation with them, answer questions that they might have with respect to what's happening in the child welfare system, what's happening to the children in the state, how are we bridging the gap from kids from foster care to adoption, and how that impacts Oakland County with respect to the number of kids who are in care versus residential care, out-of-home care, and those kinds of things. And I'll skip me because you got the opportunity to hear from me, but I'm the attorney based on, just a little bit, if you don't know, I'm the attorney on the board, and over the last 30 years, I've been actually directly involved in child welfare in some way, shape, or form, at both the state level, the national level, and I actually have adopted children and have been through the foster care system. So I bring that other side with respect to being able to input in the board from the constituent side of people who are actually adopting and who are actually having certain problems with children in foster care. So that brings another side to it, and I think that it has helped us tremendously as we work together, the three of us on the board. And I'll turn it over to Vicki.
Okay, so for Michigan Department of Health and Human Services in Oakland County, we actually have two directors. We have one director who's over children's services programs, another director who is over all of the assistance programs. And then we have separated out all of the adult services programs. Those actually have been regionalized for adult services. They are under a BSC director, which in this area encompasses multiple counties: Oakland, Macomb, Wayne, Washtenaw, Livingston, Monroe, Hillsdale, Branch. So I'm not going to cover a lot of what goes on in adult services. It was under my purview until about 3 years ago. They offer a tremendous number of services: the adult protective services, independent living services, so that those folks can stay in their homes and get the assistance they need to do that. They also do adult foster care homes, and they do homes for the aged as well. On the cash assistance side, we have multiple programs. Cash assistance both for FIP, which is families with minor children. We have medical assistance, food assistance, child development care, state emergency relief, which is the program that is utilized to help folks stay in their houses, maybe pay property taxes. If they're in a place that becomes condemned and they're renting, we can sometimes pay first month's rent and deposits to get them into new housing that is stable. And then state disability assistance, which is a cash program for those folks who are in the process of applying for disability through the Social Security Administration. On the children's services side, of course, I'm sure you're probably already aware, Children's Protective Services, Family Preservation and Prevention Services. They also do foster care, foster home licensing, adoption, juvenile justice, and they have a huge push on attempting to secure interested foster families to help foster these children. I'm going to give you a little bit of background on the individual programs, not a lot here. I'm not going to read through the PowerPoint, but I want you to see, for example, in Medicaid, we provide a lot of services for recipients in they're medically needy. These are the folks that don't have jobs with medical insurance, lower income, but ages 21, under the age of 21, pregnant, disabled, blind, anybody over the age of 65, Medicaid can be a supplemental to their Medicare. They may have a deductible, which means they'd have a monthly copayment, but they would have the Medicare and the Medicaid once they met that copayment, which helps tremendously. There's actually over 25 different Medicaid programs that we administer. And it's now the single largest insurance company or coverage in the country. It even has reached over Medicare, which is interesting. Medicaid program is both state and federally funded. Cash assistance, as I said, that's for families with minor children. That program's been set up to help them achieve self-sufficiency. There is federal and state time limits on the length of time that they can receive those cash assistance programs. So we do work with the Michigan Works agencies in helping them become self-sufficient, whether that be through resume writing, job education programs, things of that nature, so that we can get them up on their feet and out on their own. So you'll notice in this particular chart, and the data goes through 2017, we've seen a tremendous a decrease from fiscal year 13 to 17 in the number of folks receiving cash assistance. Part of that's due to the time limits, part of that's due to the economy. There's jobs out there. Cash assistance is not a large grant for families who are trying to make it on their own. And the average here in Oakland County in 2017 for a family was $354 per month, which is not livable. We all know that. In Oakland County in 2017, though, the total cash assistance payments to those families was $4,037,172. So, food assistance, you can also see there's a decrease here from fiscal year 2013 to 17. The FAT benefits decrease as the income increases for families and individuals. The average benefit is $121 per month. It's also a federally funded program, but it's administered by the state, and the cost of administration is shared between the state and the federal government. According to the Kids Count data, last data available, full data for the year was fiscal year 2017. There's approximately 30,446 children in Oakland County that receive food assistance, and that equates to 10.8% of the population of children in Oakland County. Child Development and Care, I'm not going to give you a lot of statistics on this. This essentially is a program that we have out there that is to assist parents in becoming self-sufficient. When they become work-ready and secure employment, we're able to assist with either partial or full payments based on their income with their daycare. This is one of the things that the MCSSA and our board is advocating is for an increase, because the wage that the department has that we're able to pay towards childcare costs does not even come close to what is actually being charged out there for childcare. So it's there's a big gap there. Every year the MCSSA develops what they term as priorities, and they take those to the legislative members and advocate for what is needed to help our constituents. State emergency relief, I gave you a little bit about that. That's our emergency program. There are a number of things we can help with, but there are a number of things we can't. Housing has to be affordable. So if you have somebody who's receiving that FIP grant at the average of $357, most housing in this area is not affordable. We're seeing a lot of families become extended, where they're doing multi-generations in one household in order to be able to financially meet the needs that they have. Just for your reference, fiscal year 2017, I want you to understand, it says here the monthly caseload in Oakland County was 291. That is not accurate. The average number of SER cases was 217. But the dollars put into the county in fiscal year 2017 from the SER program alone was $1,636,782. State Disability Assistance, this is the program where most of these folks are in process of applying for Social Security based on disability. It is not a retirement program at all. It's all disability based. In fiscal year 2017, we had 572 cases, and that equated to $518,911 coming into the county. This is not my area of expertise here, Children's Services, but I'm gonna do the best I can. Actually, this fiscal year 17 data given represented 29,433 children, which is 11% countywide of children living in poverty. So it's a significant number in Oakland County. Children's Services, this is not my area, as I said, so Mr. Shire was unable to join us today, so I'm gonna do the best I can to cover it. First and foremost is Children's Protective Services, and they're responsible for investigating allegations of child abuse and neglect. They receive the complaints, they do their investigations, sometimes they'll open a case, sometimes they'll transfer a case, they might get a referral from another county that comes to our county to investigate because there's some kind of conflict in that county. So they may open it, they may deny it, they may find that there's no basis for a Children's Protective Services case. In the event that they do open a case and it becomes long-term, children are often put into foster care. The foster care services, the program provides placement, supervision, permanency planning. We want these children to be in the best possible situation as quickly as possible so that they are not disrupted. That may mean that we're looking at licensing a relative that they've been placed with. There's a number of different things that occur when it comes to foster care. I guess the biggest thing for them is that they really try to make an effort to make sure that when children leave foster care, there's a permanency plan in place and children are safe.
Can I make one point there?
Can-
One point here with the foster care services, one of the things that Michigan traditionally had not done in the past, which was to, the department had required that relatives be licensed. And one of the significant legislative changes has indicated now that relatives do not have to be licensed, but they can also still receive the foster care benefits that other foster parents would have received, licensed foster parents would have received for providing for the children in their care as well. So that has really substantially impacted children in Oakland County who lives with relatives, who are in a relative placement. They can now also receive assistance for provisions for the kids being in their care, which is, I think, is a good thing that we advocated for.
When did that start? Begin?
Actually, we started that process in April of this year. It went into effect April. We did a computer cross-match to identify those persons who were considered ineligible grantees, meaning they could collect cash assistance for those children, but it wasn't the foster care payments. So it's a significant dollar increase for these families now.
Thank you. Commissioner Todd?
Well, do you want me to wait? Because I have a lot of questions, but do you want me to wait till the end?
We're almost
We'll
done.
wait
We're
till the
almost
end.
done.
Thank
Almost
you.
done. Okay. And then they do adoptions as well. They do the finalization of adoptions. I'm not gonna go into a lot of detail on that. I don't know a lot about it, and I apologize, but there is information in the PowerPoint on it. The next thing I really want you to see, though, is the spreadsheet on the furniture bank. One of the things that the board, the DHHS board, does with the budget that's provided by the county to them is gives dollars to the furniture bank to assist the constituents in Oakland County. By far and large, if you look at the data, you can see that the majority of the customers served are DHHS active customers. The dollar amount that they provide in fiscal year 17 and 18 in terms of the value of items was over $500,000. And the board provides them with $19,000. So what they're able to do with that dollar amount is very significant, and it's impactful because what we're looking to do here is to get a slight increase for our board so that they continue their activities with the MCSSA, attending the legislative conferences, attending the annual board or annual business meeting, and then continue to provide support to the furniture bank. So overall, cash coming in to the county of Oakland based on the services provided by the Michigan Department of Human Services, Social Services, way back. If they need to quit changing our name, it'd be helpful, but, is,
Department of Social Services before.
is an astronomical figure, as you can see here, and I'm gonna, am I gonna try and say this? $1,672,230,279. So it's a huge dollar source that comes in, so the board has the responsibility of overseeing a tremendous amount of services provided to the constituents in the county. And then this last page here is really what we are dealing with the board budget. Fiscal year 2019 budget, I wanted to be able to show you where the shortfalls are. So the MCA membership dues increased by $1,150.83, so we had a shortfall there. We had a shortfall in the travel due to the legislative conference, the annual business conference. We actually, in order to address this shortfall, had to cut $4,000 from the Furniture Resource Bank's dollars in order to assure we didn't go in the red in this budget. So essentially, the reason we're here is to ask this board to recommend an increase in the amount of $4,000 for the board budget. We've had the same budget for many, many years. I've been in this position for 7 years and not seen a board increase in their budget. I couldn't even tell you how long ago a budget increase occurred. That said, I think we're ready for questions.
Thank you.
Be gentle. On the Children's Services side, please.
Sure. And on the adult side, how would
Yes.
someone access the independent living services?
That's an application process. You actually can call the main number for the Department of Health and Human Services, and it will guide you. It's interactive. It will guide you to the adult services prompts, and one can be mailed right out to you, or you can call one of the local offices. Any of our general office administrative staff that are on the phones will get that information and get those mailed out to, or direct them right directly to the Adult Services office in Oakland County. There is one office where all of those staff for the entire county are centralized.
Thank you.
You're welcome.
Commissioner Powell? Commissioner Todd?
So I have a couple questions. So
Okay.
I used to work for State Representative Tim Grimal, so I had a lot of interaction with DHS and
Yes.
constituent cases in my district, and I
Yes.
served Pontiac, just so you all know. So first question is, has the caseload for the workers, has the caseload, number of cases per caseload per worker been adjusted? Meaning has more staff come in? Because at that time, when I was there, they were like 600 to 800 cases per worker. Is that still?
Well-
And if it has not been changed, what is the future change? Because that has to change.
Okay. The answer to that question would be no. And the reason behind that is because our staffing is tied to legislative funding, okay? And at the local level, we can't do anything with that. That's one of the things that the MCSSA and our board members are advocating for, is additional staffing dollars.
Yeah.
Because with the current caseloads, it's near impossible to provide the services that we need to provide. Now, we're doing better in Oakland County than we were 2 years ago. Caseloads were running 800 and 900 two years ago. When we are fully staffed with everyone trained currently, our caseloads are about 650. However, Oakland County is a large county. People apply, they get hired, they get their training in here, and they transfer to wherever they live. So it's a training county as well. So we always have new staff who can't go on 100% caseload. They start out at 30. It takes a year to get those people up to full caseloads. Right now, our caseloads are averaging probably about 710. Better than it was, but not where we need them to be,
Okay.
okay?
Great for explaining that. Another question. I can't remember if it's foster or adoption, but when a kid is transferred from the west side of the state to the east side and maybe an emergency transfer. Why is it so difficult for the adoption or the foster parents to, do that transition with the insurance, when they have like that mandate to get that kid physical done and things like that, to where sometimes they have to come out of pocket and then takes forever to get the payback?
Are you
Okay.
I just want to make sure I understand. Are you talking about a child who is currently in foster care?
Okay, so at one time we had met with a group of, I can't remember if it was foster or adoption. And one of the concerns was this insurance issue, where on the west side of the state, west and east side don't have the same type of insurance. So when you shift a kid
Right.
that is being moved from a home, it takes forever. Or a parent that adopted or foster parent is stuck with that bill, have to pay to get this kid serviced and checked out and stuff, because there's certain mandated things that they have to do within a grace period of receiving a kid. So my question is how is that, is improvements being made with that process?
There's a couple of things that are happening with that process. One is they are doing absolutely everything in their power to not transfer those kids across county lines if they don't have to.
Okay.
That's the first thing. The second thing is what you're referring to is Medicaid has a number of different health managed care plans. And you are correct, there are not the same plans on this side of the state as there are on the other side of the state. They are working to address a faster turnaround time in getting those codes updated in the system so that reflects quicker.
Got it, okay. My third question is, it was a federal change that took place, I think a year or two ago, that impacted food stamp amounts for seniors. Can you give me the background of what that change was? Because what I heard was, if a senior receives Medicaid or Medicare and they pay one or two of their utilities, if they paid both of them, they could get, they food would stay the same amount that they were receiving. But if they didn't and they only paid one or the other, I guess federal felt like they could afford their food.
Okay, quick answer.
Okay.
Quick answer. Michigan had a waiver, and the waiver was not renewed. So when you do, it happens all the time, but when you do a food benefit budget, everybody gets a credit for household expenses. So if your rent is $1,000 or $500, that's going to make a difference in your budget. If you pay one utility as opposed to two utilities, that's going to make a difference in your budget. Medical expenses, if you have $500 in medical expenses per month as opposed to $50, that's going to make an increase in your food benefit budget. So it's all based on what your expenses are.
Okay.
Not all. I mean, we look at assets and we look at group sizes, but it is an expense-based budget.
Do they include prescription costs and stuff like that too?
Any medical expense,
Okay.
if it's uncovered, so if it's not covered by Medicare or Medicaid, if it's an out-of-pocket expense, then it can be included in the budget. The Medicare premium is also included in the food budget.
Okay. I just had a couple of seniors who were like in total shock when that stuff took place, and it did reduce their stuff tremendously. And they had been on it for so long, so it kind of culture
Well,
shocked them.
Heads up, when they do the cost of living increase for Social Security, a number of seniors who are currently receiving full Medicaid benefits are going to be flipped over to a deductible. That increase in their Social Security benefits may be minimal, $10, $16. It may put them just over the income limit, and it will put them into a deductible status, meaning they won't have full Medicaid on a month-to-month basis. They will then have a deductible that they have to pay each month, and they're significant, $400 to $600. So just be aware.
And we think that that's going to be a huge
Oh, I
issue.
know it is,
And that's
especially in
one-
my
and that's-
city.
And one of the things that we're looking at as the board and the Adult Services Committee, that's a issue, because that, just as Director Cooley just said, that $10 can really cost them another $500 or $600 out of pocket that they don't have when they're on a fixed income. And there's no way for them to call Social Security and say, I don't want your $10 increase, because it's gonna totally be a ripple effect in some of our senior citizens' lives.
Keep in mind, that's based on the federal poverty limit, okay? And that has not changed. I've been here 30 years, and that has not changed.
My next question, who now can report to CPS? Hasn't they opened it up as to who can report?
Anybody can report to CPS, anybody.
Now, why was that change taking place? Or it
That's
always
never-
been like that?
that's always been
Oh, it's
like
always
that.
been like
Always
Okay,
been
that's
like
just-
that.
Okay, so that's
Yes,
just me being.
they did just expand the group of mandated reporters. Yeah,
Oh, mandated
yes.
reporters. I think I turned it over. I was writing stuff, so I turned it over, and then if I got another one, I come back. Thank you.
I just have a couple questions. Who did Governor Whitmer appoint?
As our director?
No, on the board.
Oh, on the board, Margaret Warner.
So she's a carryover from the previous governor.
Margaret Warner was a long-term Michigan Department of Health and Human Services
No, but she was appointed
employee.
by the previous governor as well.
She meet to the board.
Oh,
board.
Yes.
yes. Well,
Okay.
yes, she was appointed by the previous governor and then reappointed
That's what I wanted to know.
just for this
Okay.
next term. Yes.
And,
I'm sorry.
and we didn't mention, but, and I didn't highlight it in the report, but it is in the, we each serve 3 years. And we can continue if you get the pleasure of the county.
Okay, and then I have another question. I don't remember the furniture resource portion of your budget. Was that always there?
Yes, that's been there for many, many years.
Okay.
The name has changed. It used to be the Furniture Bank, but the name has changed.
Okay,
a
well,
few
no,
times.
I don't recall, but, okay. Now, where is this particular, is there a particular place, or do you just buy it retail, or what?
They have actually a warehouse facility as well as a showroom type facility where folks can come in, the clients can come in, they can look at what they need and pick those out, and they will deliver, Furniture Resource Bank will deliver.
Is this all new furniture, or where is it?
No. This is donated furniture. They do not take anything that's not in good shape. It's all donated furniture, primarily things like beds, dressers, larger items. Be aware that the Furniture Resource Bank also provides a very large number of porta-cribs to our Children's Services side of the department for safe sleep.
This was very, the board was really concerned with respect to, if you heard, as Director Cooley went through the numbers of what these families actually end up with at the end of the day, making critical choices in terms of food and clothing and some of these other things. The Furniture Bank was just one other mechanism that we felt for the constituents in Oakland County that we can take that off their plate and make sure that they have beds for their children to sleep in and have some decency as a family. And so that's been one of our programs that we have really been most prideful of.
So,
And we who work in social services have a form to fill out that we fax to the Furniture Bank. So we're allowed to request X number of pieces of furniture for each family.
Yes.
And generally, it's beds and dressers.
well, I have a question now. Is there any attempt to kind of do I hate to use the word campaign, but that's kind of what comes to mind, to tell people that if they have furniture in decent shape and they just decided to redecorate or something, that they could send it now. Does the Furniture Bank pick up?
Yes, they do pick up as well.
Well, see, now,
Yes.
this would be an incredible thing to let people know throughout Oakland County, because a lot of the residents just get plain tired of a bedroom set, and they just want, or the kids move out of the house, they want to get rid of their stuff and do something else with that room. This would be an incredible place to donate. In the past, I've given my stuff to Children's Village, because they too have a need. But, I knew nothing, and I've been sitting here for
Well,
a long time
I
about a furniture
do
bank.
think that there are a lot of Oakland County residents that are aware, because that's where the majority of what they have comes from. They do a couple of fundraisers each year. I don't know how well publicized that is. I do interact with Robert Boyle. He's the CEO of the Furniture Resource Bank. I will have those conversations with him and see if we can get even more information out there. The thing we have to be careful about is they're on a very, very tight budget. And the more they have to go pick up and deliver, when they're trying to do these pieces of furniture, provide them at very minimal or no cost to our constituents, they'll end up working at a deficit and they'll have to close their doors. So we have to be very, very careful about how much we solicit for those pickups.
Okay. I have one final question. It's not a question, it's kind of a statement. In many states in this country, many, many, many of them, social services are stay at the county level, okay? Has there been any thought to doing that in Michigan? I know this law was written in 1939. That's an 80-year-old law that when most of Michigan was rural.
I
other
have
than- yeah.
not heard anything about having the programs administered by the counties.
Well,
I haven't
vast
heard a
majority
thing.
of states have county
Many of
administered.
them do, yes. We just had a director that attended a urban conference for food assistance with several other states, and many of them are county administered.
Okay, thank you, Madam
welcome.
Chair.
Gershenson?
Yeah, I enjoyed the presentation as I do every time that you come. We learn so much. There is a nonprofit called Humble Design, and they essentially do the same thing that Furniture Bank does, and they distribute the furniture for free.
In Oakland County?
It is in Oakland
Okay.
County, and it's within the last few years, and I have had dealings with them, so I'm happy to share that information with you.
That would be wonderful.
Just
And, I'm sorry.
on that.
Oh.
So just so you know, Humble Designs already have a contract with the homeless shelters in Detroit. That's the only thing they'll service. They lock
Okay.
them in.
Okay,
So
so they
as-
don't service,
You know, they in my backyard.
Yeah, I
I've been
know,
all
I
in their
know.
office, and no, they could not. They would do referral base at first with DHS, with
Okay.
Pontiac, but then they switched because they got the big, I
see.
guess,
Okay.
contract to do homeless transfers from homeless shelters to homes. So that's who they
Got it.
focus on now.
Okay,
Just so
thank
you
you.
know, but.
Thank you.
I mean, future, maybe if y'all want to reach and have a discussion, that is another group that does collect, because I think the group of women is from Birmingham.
They are,
Yeah.
and I'm
It's a
familiar
wonder,
with them.
yeah.
I'd be happy to set up a conversation, but.
Yeah, I think you
yeah,
should still set up,
that-
but I just wanted to let you know,
yeah.
because I just was
Yeah.
trying to get some
Okay,
women
good.
some furniture.
Also, unfortunately, I have another commitment, but I just wanted to say to the committee, Madam Chair, I don't know, they're requesting $4,000. I don't know how that process would work, whether we would do a resolution or how that would work.
I would think we would do a resolution. I'd also like to give them a little bit more,
Yeah.
some
Right.
cushion.
Right, I think so.
A recommendation, we don't have the authority.
Right.
Right. No, we
But I-
understand that. We
Yeah.
really appreciate
I
that.
just wanted
I-
to
I
say I would
appreciate-
support that effort.
Thank Commissioner Nelson.
I just wanted to go back quickly to the children in poverty. It's quite alarming.
It is
especially
very
here in Oakland
alarming.
County to see that high of a number. Do we know what communities make, or is there a specific community that makes up a large portion of that number, or is it literally scattered across our county?
I have not seen any specific data,
Okay,
but I can tell you where the bulk of our cases are.
and where is that?
Well, Pontiac, of course.
Sure.
Okay. Madison Heights, Walled Lake, and then you start to scatter. Okay. I could actually pull data for you if you're interested that actually specifically tells you how many cases of each type we have in each zip code.
If it's not too much to ask, I think that would be really valuable information
Could I,
to have.
this is my writing hand, could I ask you to take my email address down?
Absolutely.
Yeah.
Okay,
Perfect.
okay, so that I get that request and I know where to send it, because I can't write it down.
Not a problem, I appreciate that.
Thank you.
Thank you.
Certainly. Certainly.
Any other questions? So then, yes.
So, be it if we have a situation with a constituent, cause I know it's different, right? State legislators, if they contact state, they gotta connect between the state legislators and DHS office.
Correct.
As county commissioners, do we just refer them to the state, or do you all have a contact for us on county level government to get to you, you know, how does that work?
We have a district manager in each of the 3 county offices.
So just
Okay.
contact them?
To the district manager, and for lack of anything else, my office, the director's office.
Okay.
If they're coming to you, that means they've probably exhausted trying to contact workers and supervisors, and I need to know that.
Oh,
Okay.
you know I know from the state the order.
I need to know that. We're really working to try and meet that 48-hour turnaround contact time, but caseloads, as you know, it's a struggle for us as well. Do we return those calls, or do we get somebody's food assistance opened? And sometimes we have to make a judgment call.
Well, just so you know, just to be helpful in that situation with the constituent, I will always stress that and explain that because they sometimes didn't understand.
Right.
So I will have to go into that explanation about this caseload, and you put yourself in that position. Give her time; she'll give you a call back. And usually when they came through the state office, though, I think we got bumped priority to handle the case and how they will help me in helping the constituent.
I think one of the things that we've seen as a board, and it has been something that's been discussed statewide too, is oftentimes, and I think that the state has done a tremendous job in terms of streamlining some of the process and the forms, but we find that sometimes the individuals won't follow through with giving the documentation that they've been asked for, or there may be a lapse in time when they finally get it, and, you know, the letter may have said it has to be here by this date, and the person waits 3 months later, and then they're up in arms because it's been closed, and they've got to start the process over. So sometimes we see those kind of complaints.
Right. Any other questions? So we have 2 things that need to happen. We'll receive and file the presentation, and then the second, looking for a motion or recommendation to of an increase to the budget. Yes.
Whoop, I think that has to be a request to Finance Committee.
Yeah,
And-
but we can recommend that we did hear the presentation and.
Yeah, you can
What a good
recommend, I don't
idea.
think we need a vote. I think it just has to go, or do we need a vote? I don't,
You can make a recommendation to finance committee to a vote from the committee.
okay.
And then finance committee will take up the budget.
All right, so, we're gonna receive and file this report. All in favor? I need a motion. Motion by Commissioner Nelson, seconded by Commissioner Powell. All in favor, say aye.
Aye.
Opposed? Motion is carried. Then any recommendation to move forward to the Finance Committee regarding the budget?
I'd like to make
Yes.
a motion.
What would your motion be?
To recommend additional money. Is there
Are you putting an amount on that, or just? an
No, I don't
increase?
wanna put an amount on that, but I definitely would like to, take a look at, as
Okay.
previously said, about maybe a little extra cushion other than just the $4,000. I think, if we could give a little more than 4,000, I think that would be amazing, but at minimum, I would like to make that recommendation to go to finance, to take a look at
All right, thank you.
how we can incorporate that. Thank you.
Is there support? Supported by Commissioner Powell. Any other questions? Yes.
I do have a question. The board travel, will that be consistent every single year now?
It should be fairly consistent because there are always the 2 annual meetings, the business meeting and then legislative conference. Of course, the legislative conference is always held in Lansing so that they can actually go and meet all the legislators in one place.
Right, correct.
So it should be fairly consistent. And the board, in that travel as well, is board travel for the individual meetings, the meetings that they chair or they are members of.
And the dues, they were raised. Were they-
Those were actually raised a few years ago, and we've been moving money from another line item to pay for the dues.
Okay.
That's what I wanted to speak to.
Happy to hear from you.
Thank you, Kathy.
So I just wanted to let you know that they have been constrained by this budget, and it sits in the Health and Human Services budget, and they have had to do a lot of shifting around to do some of the things they have to do, and that ends up coming out of the furniture bank. So that has been an issue for them. And I could see that, you know, that buffer that you're talking about could be really useful. I should also let you know that I did do some research through Corporation Counsel about this, because this is a really old arrangement, not knowing what the history is, and
1977.
Right. And so I wanted to let you know that Bradley Ben from Corporation Counsel did some research, and when he sifted through things that really need language change because they use old names and everything, he did let me know that in case of a District Department of Social Welfare, the County Board of Supervisors of each county forming a part of said district shall appropriate funds necessary to care for the welfare services of such county and the administrative expenses of the district department. So there's a lot of latitude there, and so their recommendations are very important to us.
Thank you. Yes.
I have another suggestion as well. I wasn't here when this happened, but there was somebody else here. I mean, I was not a board member then. But there was not a per diem given to the members of this board because they work hard. There was an actual salary, and whoever was the chair, I don't know who the chair is, doesn't matter to me, was given a little bit more, okay? Because they do an awful, remember that, Kathy? Were you here then? I don't know if you were.
No.
Okay, well, it was, probably right after Lincoln was shot, but anyway. Anyway, I think we need to look into that as well. I have no problem, I don't wanna put a dollar amount in here though, because I think that has to be worked out, but I think there's another part to this. These people, most of them have their own jobs. Margaret may be retired, I think, but the other two have their own jobs and their own things to do, and families as well, and I think we need to look into that. It was very disappointing to me when this occurred. I'd heard about it, but there was not a per diem given then. There was an actual salary. It wasn't a lot, but it was much better than a per diem, and I felt it was justified. I wasn't here when it was cut. So.
Commissioner Powell.
Kathy, is there any way that you probably could, suggest some suggestions and increase basically to modern now with this type of program? Be it if we did have some flexibility of cushioning, giving a little more cushion, what would you recommend? How does that look based on, your knowledge and with this program?
Well, that's kind of the problem. I don't have the knowledge I wish I had.
Okay.
To know, but I did find out that, as I said, there's a lot of latitude here, and I don't know if, Furniture Bank, because you are able to do things that you think are necessary to support issues in the county, such as the Furniture Bank, I don't know what the perspective would be from you. I think that recommendation has to come from you.
So I think at this point, what you can have is the committee itself can make a recommendation to finance to do just a general budgetary increase, and then the finance committee will reach out to ask further questions as far as budgetary gaps and everything like that.
Got it.
Commissioner Nelson, will you
So then,
restate the
Madam Chair, I'd like
motion?
to recommend to the Finance Committee to consider a general budget increase for Oakland County, Michigan Department of Human and Health Services.
Thank you.
Thank you.
I'll support that too.
Oh, it doesn't matter, somebody.
Supported by Commissioner Todd.
So now we have to do a voice vote, so that we can proceed moving that forward. A roll call vote, I'm sorry. So we can.
And any other comments on that motion or second, or support? Roll call, please.
Powell,
Yes.
Gershenson, Nelson,
Yes.
Cobb,
Yes.
Moves,
Yes,
motion carries.
motion carries. Thank you.
Thank
Now
you.
we need a voice vote on
Right.
the receive and file. Did we do the receive and file? We did that?
I do got one more question
Oh.
for them. Just one. Just one. You know what, never mind, I'll ask after. Are y'all gonna still be here? Or are y'all about to leave?
We were about to leave. but-
Okay, well, I'll ask the question. So the paperwork process, when people, you remember when you was just saying that delay in receiving and that may be the cause of them people having to reprocess? Have y'all changed that process? Cause my understanding is paperwork go to Lansing and then Lansing shoot it to the workers. Why is it has to go through that process? Or if, just one thing before you say something, or if you kinda don't know, is that something that, you know, I just kinda
I do.
encourage you all to look
I do.
into it? Okay.
We're now electronic case files. And so we do not have the manpower in the local offices to scan and index and put all that paperwork into the case
Makes
files.
sense, okay.
And they did an upgrade to the system in Lansing here a few months ago, and they made a huge mess because it wasn't compatible. They have now fixed that, and so the turnaround time is much faster than it was, okay? It actually now is faster than when they would drop it at the office, because for us to scan, index, and get the case file, it's actually faster for Lansing to do it. We don't have the manpower locally,
Makes sense, thank you.
okay?
If I may add to that, we
Yeah.
fought for multiple years with Lansing. Oakland County had received checks for childcare from a spouse who was paying childcare. And the turnaround in Oakland County was 24 hours. So it hit your bank account if you were looking. And then, of course, the state stepped in and tried to put a computer system in that cost, I think, 18 or, it was a ton of money, okay? And it didn't work. Okay, so, remember Kathy, I don't know if you were here, Kathy, but I remember that very, very well. What they did is decided they needed a state system, so they started in the Upper Peninsula where they were using 3x5 index cards. And they gave them a computer, which they thought died and went to heaven. But we were already so far advanced down here. It was a mess for years and years and years, and it took up to a week for mothers or fathers who were receiving support checks to get their checks instead of having them hit automatically. It was terrible. It was simply terrible. So counties like Kent County and Wayne County and us and Macomb County, where we had, in Washtenaw, that had good systems with a fast turnaround, we went back to a step above 3x5 cards, and that was, and they spent how many? $20 million in those days on that system that never worked.
Thank you. I would like to say, State Representative Ellison and Koopa in my district area, and the three of us are putting together it's called CARES Town Hall Meeting, August 21st in Clawson at Clawson High School. Two topics, senior citizens issues and foster care. So initially my response is with that continuum of services, I don't know who that's going to appeal to, but we'll find out. So we're bringing awareness and more information and open to what's working and not working in our communities.
Do you have representatives from the Department of Health and Human Services to provide information about
We do
our
have a panel,
programs?
yes.
Perfect.
Yes,
Perfect.
yes,
Okay. I was gonna put you in contact with somebody if you hadn't already.
yes, thank
Wonderful.
you. Thank you.
Thank you so much for your time.
Thank you very much.
Thank you.
Thank you. So our last item is a presentation from the Health Division. And while you're getting ready, I would also like to say, in my previous experience as mayor, I had many interns. One of my interns is Liz Carnegie, who continues to volunteer with me, and she's also an employee of the health department, so.
So the name sounds familiar.
Yes. So presently, we're working on pamphlets and booklets and a kiosk for senior citizens that we're placing around the area. With
Fantastic.
the understanding that seniors, not every senior is linked to a computer system.
Right.
So we have brochures from you, thank you, and other agencies, and we have enough donations now to purchase kiosks to start putting them out.
Great.
Floor is yours.
Okay, so,
We stand between lunch and.
yes, that's right. Hopefully no one's too hungry, but no, we'll try to get through this, and if you hear my stomach growling, that's what it is. So today we wanted to present to you the services, and we're gonna try to touch on what we say, it's all of the services, but we try to really touch on some of the most critical services that we provide. We say at the Health Division, they're actually all critical because our focus is the community and how to keep the community safe, healthy, try to protect the environment. And so we're just gonna go through a few of these. I would appreciate if you have a question to ask right then instead of at the beginning or at the end, if that's okay with everyone. So what is public health? A lot of people say, oh, that's just a place you go to get immunizations for your children. Or where seniors go for flu shots. And really, I hope, as you have seen, as we've brought things to the board, it is a lot more than that. We have an array of services that we work behind the scenes every day. The majority of what we do, you don't even hear about. And sometimes that's a good thing because if you're hearing about it, generally it's some kind of crisis or emergency, aka measles, hepatitis A. And so that means we're doing our job if some things are kept quiet. But really our purpose is to try to prevent disease, promote the health of the community, and how to protect the environment and the community every day and even in the event of a crisis. At the Health Division, we have more than 40 programs and services. And again, we're going to touch on some of those and hopefully you'll have some question about them. But we really try to strive for an upstream prevention so that in the future we don't have a downstream expense to healthcare or to the people because they continually are sick. So our mission is basically that. It's to protect the community through health promotion, disease prevention, and protection of the environment. And our vision is really to be the recognized leader in public health. And I have to say, I really feel that we are the leader in public health. And so I think we're doing our job there. And so our strategic plan priorities, right? If you don't plan for them, it's really just a wish, right? So creating a plan and strategic priorities. And the three, back in 2017, leadership felt it was extremely important for us to put a strategic plan in place so really we could talk about our goals and how do we move forward. And we took a day-long kind of group of all different levels, and we had an outside agency that came in and did some strategic planning for us. And these were the priorities that we came up with as a group. It was to strengthen organizational excellence. And in that, it really talks about customer satisfaction. What do we do to keep services running fluently for our clients? But also, how do we take care of ourselves as employees? And how do we continue to improve employee morale and move that forward for retention purposes and happy employees? Achieving an equitable, healthy community. This is health equity. We really try to embrace this value through everything that we do. But we need to bring attention to it. And so in a second, I'm going to talk about some of the things we've done with health equity and continue to do. And transforming public health. And that really is how do we become the best public health entity, right, in the state, in the county. And that's really how do we collaborate with partners, right? How do we continue to provide that service? What we try to do very frequently is not try to tackle a problem alone. And we also try to look in the community and say, is someone working on tackling this problem? So maybe it's not something the health division needs to provide. Instead, do we need to assist them? Do we need to help bring a partnership together around a plan? So does the data suggest that this really is an issue in the community and something we should wrap resources around? So we really try to use our resources wisely, because there is only so much of all of us to go around, and we really don't want to duplicate services if we don't have to. So one thing we really try to do at the health division is we try to be the chief health strategist. And that really is how do we engage as leadership, right? And build community collaborations, kind of similar to what I talked about, that investigates and takes action to tackle community issues. So we identify that there's a community issue through data, and as the health strategist, that's what we do. We look at data to say, is there a problem and how do we move that forward? We really look at non-health sectors and other sectors in the community that really work toward a culture of health, or how do we work together toward a culture of health? We, as change agents, we look to maybe broaden legislation or legislators' knowledge of what public health does and maybe what the problems are, things, or advocate for changes that we can make. And so we try, like I said, kind of working with our existing partnerships and new partnerships to really become that our chief health strategist. And this is somewhat of a new word. Sometimes you'll hear them talk, or you'll hear discussion about public health 3.0. And that's kind of that next evolution of public health and what it looks like. And so this is kind of a term, a term that people will talk about when they talk about health divisions. Accreditation. The health division is actually required to go through state accreditation. So MDHHS and the Public Health Institute comes down every 3 years based on indicators and mandates that the Public Health Department is required to meet. Our next scheduled on-site review is 2020. That's coming way too fast. But we also have decided to voluntarily apply for what is called FAB, or the Public Health Accreditation Board, or accreditation. It's called National Accreditation is what they call. And back in 2017 we came, and 2018 to talk about this. So in July of 2018 we submitted an application for this certification. And for a year now, we're almost to the end of it because that date is October 4th, which is also quickly approaching. We have had to come, they provide 12 domains, 32 different standards, and there's over 200 pieces of information that they're looking at to evaluate us, the health division. And these are not mandated services that they're looking at the state, but they're looking for QI projects. They're looking at how we provide health equity in our services, and how does our health education unit, how do they educate the community, not during an emergency, but prior to. And so there's a lot of domains that we're looking at. So October 4th is that deadline, and then after that time frame, they will come for over a week and actually come and see our health division. So it's easy to say we do these things. We have to show them how we actually put it into place. So there will be 4 or 5 individuals from the National Accreditation Board that will be coming to evaluate us.
And they may actually reach out and have conversations with some of you as well, and also our community partners. So they're not just talking to us.
Yep. Great. So I talked about health equity. So one of the one thing that we really wanted to stress was health equity. And this isn't just giving our employees a checklist saying this is what you need to do. Instead, this is really understanding cultures and how we can provide services better. So one thing that we did that we thought was important was we put together a health equity committee. And so we brought people through our agency that are from different cultures, that have been at the health division for maybe a year. Some have been at the health division for 20 years. And really what we want to do is ingrain health equity in all of our practices. And we also want to improve that culture and that understanding of cultures in our employees. And so this committee is coming together to make suggestions on how we can improve health equity in our services and improve health practices. So what we did is, one of the first items that we did is we went out and we put out a survey to our staff to say, where do you stand? What do you understand health equity to be? So then we would like to start training staff. And that's kind of our next thing, our next step is to start training staff. The other thing we did as part of our countywide health improvement plan, our initiative, hopefully you've heard of ECHO, which is also a health improvement plan, is we involved multiple voices in this plan. This wasn't just an Oakland County Health Division plan. We had over 200 participants at some point that were involved in this, and at this time, over 99 agencies that continue to provide a voice to this process. Because it just wasn't a one-time process. This is a continuous process. And so I will put a plug in that we will be doing the next community health assessment and improvement plan in 2020, so that will be coming. Something we also do as part of health equity is translation services. You know, we really look at who will utilize our brochures and our educational messages, and we really try to translate them in multiple languages. And some recent examples of that is hepatitis A brochures and fact sheets. We did Arabic and Spanish for hepatitis A, measles signs and fact sheets. We've really tried to be culturally sensitive and really provide that information in multiple documents and translations. If you didn't know, we have over 376 employees at Oakland County. So we have 273 full-time and 103 part-time employees. 15.4% of those are minorities. And so we think it's really important. I remember that question you asked. I had it ready. But we do. We really think it's important to echo our community. And we continue to strive for that. And something that we really look forward to. And we have over 10 languages spoken from employees that work at the health division, which is huge. So you're welcome. So public health codes. So the health division obviously carries out our program guided by many, over 20 federal, state, and local public health codes. That includes powers for the health division or the health officer to interpret laws for the health and safety and welfare of the people of the state and our county. It also gives us the right to investigate or inspect causes of disease, or if there is some kind of public health issue, imminent danger orders. So probably most recently, we had a vapor intrusion, imminent health hazard, if you all remember, when we had an underground storage tank. So allowing us to have that authority to be able to close a business or something if there's an imminent health hazard. There's also laws out there that require reportable disease reporting. So for schools or hospitals, there's certain reportable diseases that have to be reported to the health division. And then confidentiality, which is one of our biggest, which is HIPAA, right? We have to ensure that a covered entity is actually protecting people's rights and health information. We also, Michigan Safe Drinking Water Act, that, you know, our sanitarians and our health division are guided by those rules. The Oakland County sanitary codes. There's 11 sanitary codes, anywhere from groundwater protection to body art to racing and carrier pigeons. If you didn't know that existed, you have to look that one up. To sewage disposal. So the racing and carrier pigeon is Article 8, if you would like to look that up, at the sanitary code. So we have many rules and laws that guide what we do. And so because of that, we have staff that are required to have master's level or higher level degrees and significant professional experience. So currently, because it changes sometimes on a daily basis, we have 72 people that have advanced degrees that are required because of the laws and the mandates that we have to provide those. And even many of those additional staff that aren't required to have those advanced degrees have them because of the requirements and the laws that say, you know, these are the degrees we are looking for. So it may not be required, but many of our staff have advanced degrees. Many of them, especially in our environmental health area, have master's degree, and it's not required, so. So Nurse on Call, hopefully you are all familiar with Nurse on Call. We consider this an underutilized jewel within the health division, and I say in the community. I do think the word has gotten out about Nurse on Call. I think measles helped. So our nurses, generally we have anywhere from 2 to 3 staffed on everyday basis, take over 15,000 calls a year on a variety of questions. So we talk about a lot of times that everything may not be covered on our website because sometimes it takes a conversation with people, or there's so many items that we could put on our website that we have nurses that can actually answer those questions. So currently we have a phone hotline that can do that, but we also have email, which they receive a number of emails after hours that they, you know, answer right away to try to address issues. And again, we do a variety, a lot of flu, obviously, and immunization questions that are available. And the nice piece about this is the hotline. So if we need to ramp it up, for instance, measles, we can put additional people on the lines. We can expand the hours. We did that a lot with measles, especially when we first hit, to provide those extra hours so people can call at any time. So this is a great resource. So we have cards, we have magnets. This is something if you want to give to your constituents, let us know and we can get those cards and those magnets to you. Disease prevention, I'm going to touch on our dental program. The exciting part about our dental program is even though it's utilized, we have new staff, 2 new staff that are really energizing this program. So I think you're going to see a lot of education and discussion about this. They have some great ideas. But the dental program is really there for low-income residents with no dental insurance. And so what goes into determining whether they are approved for the program is gross income and the number of people that are in the family. I'm sorry?
In the household.
In the household, yes. And the qualification is 200% of poverty. And the dental program provides anything. We do not provide the work in-house. It's actually referred out. We have a number of companies that are part of our contract that does this. They do anything from cleanings, extractions, partial and full dentures. And so even though 50% of our programs and patients are seniors, we want to continue to get the word out even more to seniors about this program because, again, it is somewhat a cheaper version, a very cheap version if you apply and you're qualified for it for full dentures. It's only a $15 registration fee and a $15 copay per visit. So,
Just to add on to what you were saying, we went out for an RFP for these services, and we asked for dental companies that would accept Medicaid payment, equivalent to a Medicaid payment, and we have a couple, but it's providing us with, how many locations?
I think it's 5 or 7 now. Is it more than that?
I thought it was 17.
Okay. I don't know. So many numbers in my
I think
head.
it's a good number.
Yeah.
There may be 4 or 5 dental agencies,
That might
but
be
I
what it
think
is.
that there's a good number of locations around the county and even just outside the county in neighboring communities.
By locations, you're referring to particular dentists who accept Medicaid
So,
payment?
one of them is a large corporation that has many locations. And then there's a couple of other private dentists that also agree to do this. So they can take their pick, if it's, you know, whatever's convenient for them, they can go to that office.
Thank you.
Really good, great program for seniors who don't have that coverage.
So, sexually transmitted infections, in the past, you've heard it called disease, a lot of times, but the new term is really, really they're looking into infections because many STIs have no signs or symptoms. So people would say, oh, if you have a disease, then you know that you have it. And so that's kind of why they have reformulated. The idea is that you may not have signs and symptoms, or they may be minor and it's something to look for. So at the Health Division, we do over 15,000 tests a year for STIs. And when somebody comes in for a test, it's not just a test and you're positive and you're negative and you're out the door. A big component of the visit that that person comes into is education about what is it, what, you know, what to look for. It's almost like a counseling session sometimes. And so people feel very comfortable with our nurses. They come in. It's almost like it's not an anonymous, but it's a very confidential visit. You know, maybe they don't feel comfortable talking to their private physician or primary care physician, or maybe even their OB about something like this. People can come in and have a very comfortable conversation with a nurse that's very educated, very understanding, non-judgmental, and actually get the answers that they need. The interesting part is older adults. The older generation is actually our increasing population for STIs. And so, actually, here's a statistic that's interesting. People aged 50 and older represent almost 1/4 of all people with HIV and AIDS in the United States. And again, it's an educational piece, right? We're not going to talk about it. I think the more we talk about it, the more education there is about it. But I think the younger generations are willing to talk about it, right? It's been out a lot. They've had, you know, sex ed in school maybe, and they're willing to talk about it, but sometimes the elderly may not. And so, again, they're kind of less likely to. And sometimes, right, they may mistake the aches and pains of things to be, oh, I'm just getting older, but it could be a symptom of an STI or, you know, even HIV or AIDS. So it's an important piece that we're continuing to talk about. So HIV and AIDS, again, everyone that comes in for an STI test, our nurses suggest and persuade to have an HIV test because it is an important piece. And we do free rapid HIV testing, so it's a quicker turnaround. We do have case managers too that are part of HIV, so if someone has or is tested positive, we do everything possible for them not to walk out of our office without talking to one of our HIV staff. It's an important piece. It's an important handoff. We don't want to give someone a result that maybe they're positive and let them walk out the door with no information at all. So we really try from the minute they're told that maybe they have HIV or have had a positive test to wrap services around them, and that includes a case manager to really have those conversations with. We administer approximately 13,000 HIV tests a year, and it is estimated that there are over 2,300 HIV people living in Oakland County. We also have a program called Link Up Oakland, and it's a free confidential service that helps those living with HIV in Oakland County to access medical care and support services. And again, that's what we have nurses that are actually involved in this program that really link to these individuals and provide one-on-one assistance as much as necessary, whether that be in the phone, whether it be a home visit, whatever is needed. So the next one is the TB program. A lot of people may have heard of this, but we administer over 14,000 skin tests per year. Tuberculosis still remains the second leading killer of adults in the world. So it's still an issue out there, and a lot of people are not aware of it. Even though TB is still significant here, it's still the rates are still below the national average for Oakland County residents. And again, same thing here. Anytime there is a positive case or an active case identified, we kind of wrap our services around it. We have an actual nurse that's considered a case manager that's working with that TB patient for testing, treatment if needed. If they are taking medication, We may have a nurse that has to see them take that medication, and so they're physically going out and creating relationships with these individuals.
365 days a year, there's a nurse out there observing these individuals taking their medications.
These
It's that
nurses
important.
are committed to. These are two of the most committed nurses, not that they're not all, to this program that are really out making sure these clients take their medication. So there is a shortage of TB tests out there. So I think there was a press release or we had some messaging go out about it. So the Health Division or Oakland County, we're prioritizing based on the CDC recommendations, so.
I know, working in behavioral healthcare myself, my primary doctor has made it very clear, I mean, I have to go in and get my TB test done. And they no longer carry it because of the shelf life is so short that they are literally directing any and everybody coming into the office to go down to the
A lot of places have
Oakland County Health
implemented.
Department
Yep.
because they aren't keeping the TB
Right.
immunizations on hand.
Yeah. Let's hope the shortage is over soon.
Right.
So, yeah, that's
3 to 6 months.
yeah. So immunizations, again, this is something people do know about the Health Division. We do provide them in-house, but I think the one thing to know that even though we do the span of life, right? We start with infants and we, go through or offer through adults. We're continuing to do education and outreach into the field. We think that's important too, especially, we talked about measles. When there's a real issue, we really do want to get out into the community because that is important. People may not want to come to the Health Division. I think it's a great place to come, but people don't, sometimes are like, oh, I don't know if I want to go down there. So continuing to provide those services are important. And we do, just in case you didn't know, we do have a sliding scale fee for immunizations. We don't want to see people leave. If there's a need for the vaccine and they want the vaccine, we want to try every way possible to get them the vaccine. We also have what's called Vaccine for Children. We're seeing more and more pediatricians that don't want to carry the vaccines. It's very costly. It's tough. There's a requirement for refrigeration and freezer, keeping them at a certain temperature, and it's difficult. If the temperature goes out of range for a refrigerator, they may have to get rid of vaccine, which can be very costly. So we're seeing more and more patients and clients coming our way, especially children, for vaccines. And there is a program called Vaccine for Children. So if a child does not have insurance, or if they're underinsured, we can offer it free of cost. So hopefully you got a piece of paper. It's a handout. It's a stories. So I think client stories are the best. When you get a client that tells you about a service that has impacted their life. And so in your handout, there's a story about hepatitis A and the outreach at the Oakland County Jail. So I'm not sure if you're aware, but since hepatitis A, the outbreak started almost 2 years ago this fall, we have been at the jail almost every single day providing vaccination to those high-risk clients. And so we have nurses that actually take the vaccine to the jail and actually provide it to the inmates. There's another story about measles that we wanted to provide you, and also a story from an Oak Park resident and the measles outbreak. So we wanted to share those. And we're going to maybe continue to see more and more of these diseases that were eradicated as, parents decide not to vaccinate.
Or change the schedule.
They may want to increase the time it takes. They don't want their child to get 5 vaccines at once. So they may delay and spread out those vaccines. And as we continue to globally visit other locations that maybe have these diseases and people are under-vaccinated, we may continue to see some of the diseases like polio and, diphtheria. Hopefully that's not the case, but again, something that we're going to continue to watch and see what happens. Children's Special Health Care Services. So this is an assistance program from the state of Michigan where special health care needs of medically eligible children and some adults are provided. So to qualify for this benefit, it's based on medical condition, not income. So there are more than 2,700 diagnoses that could get you in this program. Anywhere from asthma, birth defects, burns, cancer, cerebral palsy, visual and hearing disorder, cleft palate, cystic fibrosis.
Can I ask a question?
Mhm.
So it doesn't matter what your income is, any child is qualified for these services?
The only change would be if there's different participating dollars that the family has to contribute.
Okay.
Yep.
Okay,
Yeah, there's an annual fee that they may have to pay based on,
Okay.
on
But
income.
it's still very reasonable,
Yeah.
like $175 a year up to $2,600 a year.
depending on income.
Yeah.
Okay, that's good.
But what they get back is just tremendous.
Yep.
In terms of they get a caseworker, nurse caseworker that helps build a plan of care. They have many, many specialists. The nurse is trying to pull it all together into an easy format for the parent, and also looking for many things that they can get reimbursed that's costing them a lot of money.
Okay, thank you.
So the infant toddler development assessment, the health division actually receives the most referrals in Oakland County for this. So what they do is if someone identifies that there is a developmental delay somewhere between birth to age 3, they would receive, or the health division would receive a referral for this. And again, we have nurses, we're talking a lot about nurses today, nurse that would go out and kind of, they gain a relationship with these families and really work through referring them for multiple things. They can help with nutritional, to get them services for nutritional. They act as a liaison and really work on referrals and really advocate for families to receive school services when indicated.
Who are the referrals from?
Doctor's offices.
Doctor's offices,
But people can self-refer. They can say, I'm concerned about my child, and the nurse does a very comprehensive assessment.
Okay, thank you. Anything else on that one? Okay. Nurse-family partnership, we've brought this before you. This is a grant actually that we receive, that we bring on a regular basis, I think annually. This program is for first-time moms that are referred to us. It's really working to address possibly, I guess I said, what they're looking to do is address neglect and abuse issues, or prevent neglect and abuse issues, and as well as infant mortality. This is income-based, but our nurses work with one-on-one first-time moms from their first trimester of pregnancy through their second birthday. So these nurses really do form a bond with these families. And they're in there, they could be in there, 2 days a week, and it really is a process in which the parent or the mom has to say, I want to engage in this process and I want to be in it. And you have to say you're going to be in the program for 2.5 years. You have to agree to it.
So are these the only communities you go into, or, okay,
Yeah,
so,
currently, yes.
It's
okay.
required by the
Yep.
funding.
Yep, it's a grant that we receive, yes.
Is there any way we can get a grant for other areas?
Not at this time, and we've really pushed the envelope. It was Pontiac only for many, many years. And we really, really pushed to try to get some of these other high-risk communities in the program. And I think over time it could expand as home visitation dollars are freed up in Washington. And the
'Cause-
only other way is
yeah.
to find,
I don't wanna let these ones go, but I'd like to have, because there are pockets of
there
poverty
certainly is.
throughout the county where people need this help. But,
We agree with
cause I remember you were once in Berkeley, or, yeah. I remember some people in that area getting some home visits, but,
Well, we do have other home visitation
Okay.
outside for mothers, but it's not this intensive nurse-family partnership
Okay.
program.
all right, thank you.
So we're in every community in terms of home visitation.
Okay,
And I do think they try to mirror some of the best practices that they do in this program, even in our regular community nursing
The
program.
difference is those nurses have a much higher caseload. Nurse-family partnership nurses have a very low caseload, so they can have very intensive visitation. They literally become a part of the family, very trusted.
Wonderful. And just for the first child, is that correct?
Correct. They
right. Okay.
believe that the evidence shows that it's that first child where they can really make strong impacts with really helping that mom develop habits, and the second child, they're not as successful. So that's why the program has put the limits on that.
Okay. Thank you.
Shelley, from experience, at least participating as a mother, first-time mother in the nurses program is phenomenal. So if that is what I got, I mean, if it's the same what they're offering or even more, phenomenal. I think it's the best program they could have for first-time mothers, and I was a product of that. So thank you.
We really love this program because it goes beyond teaching a mom that what they can expect during during their pregnancy, and even having a newborn baby. It goes beyond that. They're helping with true life skills, helping the mom to set her own goals and what she has in her hopes and desires, and helping her navigate going back to school maybe, or work. It just from balancing a bank account, just any help that nurse can direct them to get the resources they need. She's there to help really do some with life transformation.
And I think on your handout, I know there is one, I think it's about a 13-year-old,
Yes.
and it's just an amazing story to hear how the nurse encouraged her to go back to school, and I'm pretty sure she went back and got her bachelor's and finished,
Yeah,
so,
we
yeah,
have a
so,
few like
yeah, a
that.
lot of, so, yes. It's good. So, the next program is the Nurturing Parent Program. Now, this program, again, is, it works with high-risk families and is designated to reduce or eliminate neglect and abuse in families. This, again, is a nurse that goes into the home. It's 16 weeks that the nurse is actually in the home. And the interesting part of this is there is 80 modulars of parenting curriculum that is available. And the nurse and the parents, mom, family, they work together to decide which modules they want to complete. So the family is actually, or the mother or the families are actually deciding what they think is best for them and what they need. And I think that when you have somebody engaged like that and chooses what modules they want to, they may be involved a little bit more. Instead of a nurse coming in and saying, you're going to do this, this, and this, together they're deciding what works best for the family. And so we have great success out of there. Again, they're in the home. And we actually have a waiting list for this service because there's so many referrals that we have received from hospitals and, like she said, word of mouth and other agencies in the community.
It's like my all-time favorite program. I can't help
This is
but add a
Kathy's
couple
favorite.
of words.
I know, it's good. You're good.
And because the nurses in the home, and if you met our nurturing parenting nurses, you would love them. They will get in, get down on the floor, just show how to play with a child. There's so many people that we don't come with manuals about what's appropriate at what ages. And they get down and they really show them, they really, really work to teach a parent, what should you be expecting from your child? Because that's where we get into trouble with abuse. Parents not really understanding, you can't expect that at this age. And so discipline isn't going to help you achieve that. And so they really work on that, and they really focus on how to redirect a child rather than going down, the path of discipline that will get them into a lot of trouble and be very traumatic for a child. This is a tremendous program that came to us because MDHHS wanted to make referrals to us initially, but we have kept it on because it was so well received in the community, and we're even using it with our Children's Village families as well. So it's really phenomenal.
Commissioner Powell?
So there's been a major issue in our community, in my community rather, for like parent engagement. So does this kind of focus on or provide modulars as far as the parent engagement piece with kids? Like,
Absolutely.
okay, so one other question. So, to start, I was thinking of maybe doing a parent and bringing in someone with a profession. Okay, but it'll be our PAL families to start off with. Is that something you guys are? Yes, thank you. Okay, I'll talk to y'all later about that. Okay, thank you.
So the next one, next service is WIC. A lot of people are familiar with WIC, have at least heard a little bit about it, but this is an amazing program. Currently, we have somewhere between 9,000 and 10,000 in Oakland County that we see. Sometimes as the economy gets a little bit better, you know, people are less engaged in WIC, but we don't stop with that. We are engaging, we're out there, you know, trying to encourage people to come in for their appointments. We actually have 10 WIC locations that Oakland County Health Division oversees. Some of them are in Ulsa, so Ulsa may operate them. We actually have 3 offices in Oakland County, that Oakland County Health Division actually operates. That's one in Pontiac here. We have an office in Southfield, and actually we are co-located with Easter Seals in the old county building in Bond Lake. We went back there. So families are seen in WIC every 90 days. Children 0 to 5 years are actually eligible as long as they meet the eligibility requirements. The food assistant comes in the form of $50 to $150 of food package, depending on if a mom is pregnant, if she's breastfeeding, you know, number of children in the home. And actually, the interesting part, people don't know this, but men are actually eligible for WIC as long as they have a child under the age of 5. And we're starting to see more and more grandparents that are caregivers that we're starting to give those benefits for.
One of the biggest challenges we have in this program is keeping them engaged till age 5, and it's something we're really working on. Because it's a phenomenal benefit, and we hate to see them lose out on that.
So community nursing, we kind of touched on this. Again, we have nurses out in the field that see, you know, any postpartum, antepartum, mom, somebody trying to breastfeed, just with assistance. Again, as we get referrals, we have nurses that are in certain areas. We generally see people that are on Medicaid, but again, if we receive a referral and a nurse has a conversation with someone and this person really needs assistance, we would go out and actually offer assistance to someone, especially if somebody's trying to breastfeed with a new mom. You know, any way we can get resources out there. We really educate them on, you know, different things, especially after a mom comes home and maybe doesn't have any support by family, and what can I provide? Resources, transportation to and from doctor's appointments, or maybe to receive MDHHS services. I actually went out with a nurse just once, this is one story, and she spent 2.5 hours on the phone just trying to get transportation for a mom to get her family to a pediatrician's office. And that was, for that visit, that was her sole focus, but it was one of the most important things she could do to get those kids to a pediatrician. So, again, I can't say enough great things about nurses. They really are
And they really
amazing.
work on safe sleep too.
Yep. So health education, we come and talk a lot about health educators a lot too. They're a staple in the organization. They're really the ones that are out doing that education out in the field. I mean, our nurses do it, our sanitarians do it as well, but health educators are trained for it. They are actually trained to facilitation, so they are responsible for really collaboration and facilitation of our 10 community collaborations and the 7 sub-communities and work groups. And they talk about anything from maternal and child health to chronic and infectious disease prevention, injury control. They do car seat checks, car seat installations. They talk about measles. They talk about a wide variety of things. And they also do all of our media interactions. They help Kathy and I guess, with our media interactions. They help us with social media. We have a very, very robust social media plan at the Health Division. when we talk about a problem, that's probably the number one thing that we talk about first is how are we going to communicate this? So we put together a communications plan, and obviously we know people are on their phones a lot nowadays, and so how do we meet that social media platform? Because that's where people are. They're more likely on Facebook, Instagram. I don't even know what the new ones are. My kids tell me I'm out of date on that. I didn't think that would ever happen, but it does happen. So yeah, they're amazing, and they can talk about just about anything. We also have a public health speakers team, if you're not aware of that. So it's not just health educators. Health educators lead the team, but we have a wide array of employees that are experts on topics. And so there's a request form that anyone can ask us for, and we will go out and do a presentation. Weekends, nights, weekends, we're coming to Pontiac. We're looking forward to that as well. So, and they also do our website. So we're always updating it. We know we don't have everything on there, but we're always looking for ways that we can better our website so it's easier for people to find the information that we do have. So, did you need to get up?
I'm sorry,
Okay.
say again.
No, I thought you just needed, I thought you, oh, I thought she needed something, I'm sorry. I'm taking
Keep going.
verbal, okay? I'm trying to go fast. Hearing and vision, so we are still in the schools. We actually schedule for every school, and I have to take a plug for my daughter up there. This is my little one. It's the first time I've seen this, so. We also do screenings in our health division. So if a child is screened at school or misses a school day where they provide that, we actually have follow-up where they can come into our clinics to make it easier for them. I think the interesting part is we do approximately 132 hearing and vision screenings, and you'll see a statistic in a second, where 15,000 of those required some kind of follow-up. So where a parent may not take a child or realize that they're having vision problems, talk about a headache, where our hearing and vision techs are in the schools identifying these, and it gives the parents, a heads up so they can follow up with either a hearing and vision professional, depending on which side they have discovered. We do public, private, and charter schools in Oakland County, so we do all of them. Nutrition services, we have nutritionists that actually go in the homes. Generally, it's a referral for a high-risk pregnant woman or infant that maybe is failure to thrive. Maybe they're not seeing them gain weight. And so we have amazing nutritionists that are actually in the field. We do overweight and obese children if we get, and even chronic disease. We are even teaching parents how to liquefy foods so that children that are on feeding tubes can actually receive additional nutrients and not just Ensure and something. So that's something that's emergency preparedness. Since 9/11, we've had emergency preparedness in the health division. We're really looking at planning for maybe a flu pandemic or a measles outbreak, so we're planning ahead of time so that when it does come, we're prepared. And something new that, you may hear about, especially if your school districts reach out to you, we're reaching out to the schools so that in the event that something happens and we have to provide medication, how the schools can enhance and help our planning so that we don't need to see 1.2 million people through our health division maybe to provide medication. So we really get out there and talk about the importance of being prepared and what parents and schools and families can do to be prepared. Hopefully recently you saw one small piece of the accreditation process is called Project Public Health Ready. So our emergency preparedness team were just recognized as only one of 500 in the nation that actually are accredited for emergency preparedness. So that was a lengthy process where we, similar to what I talked about in accreditation, for over a year we had to gather documentation and show why we are prepared, and we actually received this recognition from NACCHO. So.
I just have a quick question on this. So, yeah, you're prepared for floods and storms and tornadoes and other terrible stuff like what we've been going through in the past weekend? Okay,
Yes, we're very prepared. The interesting thing about our plans.
are you working though with the hospitals as well?
Absolutely, we meet with them every month on our planning, and we do a
Okay.
lot together, and our long-term cares, and our dialysis centers. And we work in conjunction with Homeland Security and their planning efforts.
What about our locals? Are they aware of this as well? Because oftentimes, let's be fair about it, something could happen in one of our local communities.
Absolutely.
Okay,
So in terms of, plans are built in Homeland Security and in health, and they have different focus. And I think that Homeland Security does a lot more with the community planning, and in fact, they have gone around and visited and worked alongside them as they build their individual plans that also must be able to, they have to be in agreement with the county plan so that we're not all doing our own thing. And they're being, their plan will refer to ours refers to them, and they coordinate really well together. Health Division is more health focused, all hazards plan, and the school pandemic planning. But the interesting thing about all of our plans, whether it's at Homeland Security or at the Health Division, and by the way, they all reside in the EOC together as well. But the interesting thing is how many times when we've had something come up that doesn't have anything to do with what that plan was, there are components and sections that we go and pull out of it and apply to the situation. And it has worked beautifully time and time again.
okay, so now I have a quick question. We know that, a follow-up to that, we know that our local fire departments can all communicate and our police departments and so on and so forth. What about our private ambulance services? Are they part of this as well?
Oh, absolutely. Yeah,
So,
so we
If
also.
we have a disaster, whatever it may be,
Yep.
okay, we don't have enough EMS trucks in this county, I don't think, to transport a large number of people.
And that's something that Homeland works on. When we run out of resources here, they have arrangements outside of the county, outside of the state, that they can then pull in and get more resources.
Using private resources as well.
Absolutely.
Okay,
Yeah, our Medical Control Authority also is very helpful. They participate in all of our planning. They attend all of our planning meetings. They provide us tremendous access to additional resources.
okay, do we have, well, this would be a local question, but I wonder whether our locals have people to man facilities locally while the pros get out there and do their thing, that's a question for local government, I guess.
I do know there's a lot of planning going on in this regard, and Homeland Security certainly could answer some of those questions for you as well.
Thank you.
So the next is food safety. Most of the time you hear about something, it's in the news, right? They have somebody talking about the Dirty Dozen, but a little bit about the program is we have approximately 4,500 licensed food establishments that our sanitarians go out and do unannounced inspections 2 times a year. We look at, handling procedures. We look at how staff incorporate food, safe practices in the agency. And I think one thing to realize here is we get a lot of maybe complaints, right, about food, health-related complaints, especially in restaurants. And our sanitarians go out and just about probably at least 95% of them and actually evaluate what's going on. So this is a very important program, obviously, that we take very seriously, and we make sure that the food is safe in Oakland County. It's one of our high priorities. We also do temporary inspections, so you'll see a temporary event at your local festival. We're out there, our sanitarians are out there doing those inspections as well. We do actually we don't do vending machines anymore. That's actually a state requirement. We do mobile foods, so you've seen a big increase in mobile food units And so they're required to be inspected, so our sanitarians are out doing that. We do school and kitchens. And we also provide education and safety classes. So it talks about the food service manager certification course and the basic food safety class. Oakland County Health Division was one of the first, if not the first, county that actually implemented what we call Article 4. It's one of the sanitary codes that required every licensed facility in Oakland County to have a certified manager. And so, obviously, we've made it a very strong requirement, and
And the state utilized our sanitary code article to build their statewide requirement for that.
so we always get one question about why don't you have your restaurant inspections online? And so, although we understand the importance of people wanting to know what's going on in their community, we feel like that's a snapshot in time, right? So one time that a person has gone in there in a snapshot of time, it doesn't tell the full story. And so we do have the capability, or people or the clients can FOIA these, because we like to tell a conversation. We want to tell you about that inspection. We want to explain to you what this is about, because you may see one restaurant, what you might think is an A+, right? But they have multiple violations or critical violations or priority violations. They change it every few years. It's been a long time since I've done an inspection, but and we want to tell you that story, want to explain it to you so that you understand what that really means. We don't do letters here, but a letter may not mean anything, and we want to have that, explanation on.
It's better to review the inspection report.
Right.
Okay, do you guys do churches? And I use churches with a broad brush because I have something I need to
Not
talk to you about. I have another question that kind of relates to that. Livestock. What do you do anything with livestock inspection?
Michigan Department of Agriculture and Rural Development does it, MDARD.
That's the state. That's a
Okay.
state agency.
So,
We don't do grocery stores.
okay, you don't do grocery stores? I've had experience with grocery stores. Thank you very much. I'm still waiting for them to call me, but I'm not holding my breath. Okay, so,
We think
You-
we should be doing grocery stores.
pardon me?
We think we should be doing grocery.
I think you should be doing grocery stores because you could live and die and they wouldn't come out to inspect. I agree with you. They don't care. Anyway, that's the state. Sorry. Okay, thank you.
So the next thing is water safety. So obviously, we monitor groundwater for the county. We look at contamination areas that are in the community. We issue private and public wells. And we look at every water sample that actually comes into the agency. So private agencies, public agencies may submit a water sample for, that, want to know what the quality of their water is. We have a sanitarian. Sometimes they come to our lab, sometimes they don't. Total water samples in 2018 we reviewed were over 41,000. So we have a sanitarian. A lot of times people take resamples, but it's a big component of our environmental health section. And so when somebody has a positive coliform sample, we do education about what they need to look for, especially if they're on a well system. Obviously, we issue all the well permits in Oakland County. We inspect public swimming pools and spas. And as you have seen, we've done a few discussions or put out press releases about this. We do bathing beaches. Our students that come in for the summer have a big component of this, and so we do testing, and then we actually report that out. Shelter and prevention. So we inspect licensed daycares, adult foster homes, group homes, and campgrounds. We actually do plan review for daycares. So we do assist citizens when they have questions about radon. There's always a lot of questions about radon, so we have staff that actually assist with that. We respond to mercury spill. So if we get a call, we have some special equipment that we can use to work on mercury spills. A little earlier, I talked about the lead grant. So we respond to high blood lead levels. Recently in the news, we told a story about a sanitarian and a nurse that found a child that had extremely high lead levels. And the story is in your handout, but it actually led to a national recall of spices. what their work did. So because they discovered in a small canister of spices and realized that's what was causing the high lead level. We do body art, we do campgrounds, we do air quality tests if requested, and pest control prevention. So we get a lot of referrals and requests to come talk about pest control, rats, other things, and so we actually respond to those as well. So the next one is land programs. I wasn't gonna touch on this because Tony Droughts recently came, if you all remember, and did a whole presentation on our septic program, and so I was just gonna kind of go past that. But I just wanted to kind of let you take a second and look over some of the data that we have here. I kind of talked about these. This looks at some of the environmental stuff that we've done, talking about inspections. This talks about some of the services for immunizations, HIV tests, CD cases reported, over 17,000 that, close to 18,000 that we investigate through our nurses and our epidemiologists, which we didn't really talk about much in there. So, WIC, we kind of talked about. But the last thing I wanted, or last couple things I wanted to finish on is our community partnerships and coalitions. To us, this is public health kind of moving forward. How do we wrap our arms around a problem? And that's with our community. It's not just one group, Oakland County Health Division doing the work. It's all the services programs, anybody we can bring to the table that wants to take care of a problem. So currently we have 10 partnerships that are listed here. We truly believe that there is no single agency that can move the needle. It has to be all of us together, and how do we do that? And ECHO is one of those. I mean, that's our biggest one. All of these community collaborations are moving the needle in some health issue. I truly believe that.
We've been asked nationally, I've spoken a couple of times nationally, I think Leanne has too, what makes our coalition so different than in other jurisdictions across the nation? And we believe our secret formula has to do with the fact that A, we live in a county that is very collaborative, but B, we have supplied every single one of our collaborations with a health educator who helps the group do goal setting. They do a strategic plan, and they have something that they're constantly trying to move towards. They just meet and talk. They have agendas and they have evaluations. They're constantly asking for feedback and evaluation from the members of the collaboration so that we can hear their voices privately and keep those moving forward. It makes an enormous difference. I've talked to people across this country that cannot keep collaborations together for more than a year, sometimes two. We have some that started at in 2000 that are still going strong.
So quickly, I just wanted to touch on grants. You hear from us a lot because we bring a lot of our grants here. So currently, we have around 13. Some end at the end of June, some end at the end of August. They are very different. So we really do try to look for grants that will impact our work or help us achieve one of our goals. We don't just go for a grant because, ooh, it sounds fun. It really needs to, we really look at our strategic priorities and say, does this meet one of our strategic priorities and something we want to move forward with? So, we read 3 this morning, and so we just want you to know you're going to continue to hear from us because we are always looking for grant money when we can. So I wish I had an hour to talk about emerging issues, because a lot of times these are unfunded mandates that come from the state, or unfunded issues. It's 5 o'clock, 4:55, we get a call from the state that there's, on a Friday, it's always on a Friday, that there is a new issue. And some of these things, again, measles, right, kind of dropped in our lap. It's not that we weren't watching for it, but we just weren't expecting it, should I say. Total, most number of cases in Michigan, it hit in Oakland County. I think our group did an amazing job to try to limit the exposure and the education. But the next measles is coming, that emerging issue, right? So you'll hear about harmful algal blooms that's in the lakes, PFAS.
PFAS, we got a call 4th of July of last year.
Yep.
hey, health department, how about shutting down Kent Lake this weekend because they can't eat the fish because of PFAS? So that's how we receive these emerging
And
issues.
we're gonna have a call on 4th of July at 11 o'clock, and we expect you to be on it, right? And, we had 5 staff that responded and were on it. We all listened to it. So it happens, we're used to it. It's not fun, but we respond that way, we decided. Same thing with vapor intrusion. We had no idea there was any work going on in Franklin, and we got a call. This one was a Monday evening at 4:30 saying, we have a real problem and you need to deal with it. And we did. That's where that, endangered species, that's not what I meant, but anyway, we found that underground storage tank. They've been doing all this work, and again, we're here till 9 o'clock at night trying to make sure this health is, Oakland County health is safe. Legionnaire's disease, a few things. We continue to see an increase of cases in Legionnaire's disease. Again, I could do an hour presentation on that, but it's in the community, it's in the earth. And so we're going to continue to see, as more hospitals learn about it and test for it, we're going to see more cases out there.
We work with all of our hospitals on water plans to make sure that they're doing everything they can to monitor their water systems for Legionnaires. So there's a lot of work
Yep.
to do.
And so we're going to continue. I know she has to go, and I'm
We
going to
have a
be
meeting.
quiet.
I'm
She has to
really
go.
sorry.
The state's, just a
You're gonna
couple
have to
things
walk.
to hear about. That's okay, I don't mind walking. The statewide sanitary code, the state has been trying for many years to try to put a statewide code down. It's not that we're against it, it just needs to make sense, right? It needs to make sense for Oakland County, it needs to make sense for our residents. And if it doesn't, we need to oppose it, right? Because we need to make sure something meets the requirements for our community. Emerging pathogens, we're always looking for what's next. And so there are things that are what next on the horizon. And we have an amazing medical director that's always looking to see what's going on. So we'll be bringing other things to you. And hopefully, we don't see it here, but at least you're aware of it. Lead rules, just to bring this up, there was some law passed that in 2025, the lead levels in water and in blood levels are going to be reduced to 12. Yeah, 12. So in 2025, and so there's a recommendation already that child and school and daycares are monitoring for this. And so if the levels are different, then some believe that, especially in water, right, we really need to make sure that it's reduced as much as possible. So yeah, that's it. That's not it. We did it kind of fast because I knew she had to leave. So as we bring grants, obviously we'll bring those programs to you too, to explain those. So any other questions?
All right, we need a motion to receive and file the presentation. Motion by Commissioner Powell, support by Commissioner Tug. Any other questions? Pardon? Yes, yes. No more questions? Okay, roll call, please. No. All in favor, say aye. Aye.